The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Good day to you. Good morning, good afternoon, whenever you're listening to this. We are gathered here today, this Tuesday, for the next episode of TMD Demystified. I am Tony Urbanic. Title of this episode will be Bruxism and TMD, Stress and Anxiety, What We Know and What We Don't Know. Anyone who deals with someone with TMJ knows that these patients, when they present, more often than not, almost exclusively, have a history of anxiety or stress. And we're going to define both because they are not the same. Anxiety and stress are not the same definitions. I started out many years ago treating TMD surgically, and I was quickly reminded by all my medical colleagues in the doctor's lounge, in the surgical lounge, waiting for the next case to clear so we could start our case, that TMJ patients are crazy. Why do you want to treat patients and do surgery on patients with TMJ? Because they're crazy. And we've talked about that before. TMD patients are not crazy. They act crazy sometimes. They get very emotional sometimes for various reasons. But the one of the common denominators about the symptoms is that most of these patients are very anxious, and that it is well documented and accepted and realized that TMD is associated with stress, anxiety, and stress and anxiety bring on bruxism. Well known. I recently did a written blog commenting that the recognition of this problem goes all the way back to the Bible and a Bible verse. I think it was Matthew 8, I believe. I believe it was Matthew 8. It talked about the weeping and gnashing of teeth. Weeping and gnashing of teeth. Anxiety and bruxism. Anxiety and bruxism. Well known, well accepted, goes back at least 2,000 years, probably longer. Now, we know that. Now, what do we know besides that? Well, first of all, let's cover this a little technically, and then we'll kind of cover it as to how you handle patients or how you talk to patients with the problem, what can be done about these issues meaning the bruxism. What do you do about the bruxism? What do you do about the stress? What do you do about the anxiety? Those are the issues that come up in discussions about this problem, whether they be discussions with patients or other colleagues or congresses or books. And this is a real soft and fluffy area to discuss, and there will be a lot of disagreement for sure about what I'm ready to say, but stick with me. So first of all, let's clear these two words, stress and anxiety. So first of all, and it's this common knowledge, stress creates anxiety. We all, if we live on this planet, are stressed at times. Some people have more stress than others. Some people accept more stress than others. Others do not accept any stress at all. We all very familiar with the concept that what stresses one person does not stress another. And at times, what stresses a person at another time in their life does not stress them. I have been a private pilot for 46 years, and I am not stressed by flying an airplane, but obviously there's a whole list and litany of people who would be very stressed sliding into the left-hand cockpit of an aircraft and flying. So what stresses one person does not stress another. And then a stress beyond a certain point will create anxiety. Different kinds of stress. There are emotional stresses, there are physical stresses. So that's why I say we're all familiar with it, but I want to make the distinction between stress and anxiety. Stress brings on anxiety, and what stresses one person does not create anxiety in a different person. Same stresses, exact same stress. So, but we know stress brings on anxiety, and anxiety brings on bruxism. Now, how does that actually occur? Well, there's a lot of things we don't know about it. But let's talk about, first of all, what is bruxism? Let's get that cleared up and get that definition. Bruxism is clenching and or grinding. And I'm surprised at the number of doctors who do not make the distinction between those two, grinding the teeth, to, fro, lateral, right and left, and just clenching. But from a physical point of view, they are both equal in doing damage to the temporomandibular joint. So you can clench without you can clench without grinding, you can grind without clenching, or you can do both. But both of them, clenching and or grinding, better known technically as bruxism, will, over a period of time, damage the interior structures within the temporomandibular joint. And that, just to repeat myself for the multiple 10th time, bruxism is only one of the three primary causes of damage within the temporomandibular joint, which then creates chronic inflammation within the temporomandibular joint. The other two are acute trauma of various kinds, most frequently motor vehicle accidents, but any kind of trauma to the face and the jaws, especially whiplash injuries, which then over time, the acute trauma converts into chronic inflammation. And so acute trauma can create chronic inflammation. And then the third modality to create chronic inflammation and trauma within the joint, which creates the inflammation, is functional malocclusions. So bruxism is clenching and or grinding, and it is primarily involuntarily. You cannot have, well, I guess you can clench or grind voluntarily, but you can't do it to the degree and the frequency that would cause damage to the temporomandibular joint. So it's the involuntary clenching or grinding, night and or day. You can do it at night only. You can do it at day only. You can do it at night and day. So bruxism is night or day, involuntary clenching and grinding. Definition of bruxism. Now, motion of the jaw, of the mandible, is created by coordinated contractions of the muscles of mastication. And coordinating those muscles occurs in the brainstem, at the nuclei within the brainstem of primarily the fifth cranial nerve, sensory portions, motory portions of the fifth cranial nerve in the brainstem. Now, let me see if I can bring up that didn't, must have lost it. Let me see if I can find it again. Sorry, I don't think I'm going to be here. Let's do it this way. See if I can bring this up real quick, what I'm looking for. Give me a minute. There we go. And let's do this and this. All right, excuse me for that faux pas. This is just a diagram of the brainstem to show you, to remind you, and maybe you never did in your anatomy program in dental school and basic sciences, take a look at the brainstem or neuroanatomy and of the nuclei of the cranial nerves within the brainstem. The point of this diagram is only one point I want to make, and that is the proximity of both the sensory and motor nuclei, which is where the origination of the stimulation is coordinated through these nuclei. And the proximity of these nuclei, both sensory and motor, of the multiple cranial nerves are all juxtaposed within the brainstem. And just to clarify, this diagram shows both the trigeminal on this side and the trigeminal motor and several other nuclei of the, in this case, the 10th and the 11th, the vagus and the hypoglossal, but they are all juxtaposed bilaterally. So this is not accurate as to only these are on the ipsilateral side and these are on this ipsilateral side. They are juxtaposed where there can be interference and discoordination between these nuclei. Now, and I just wanted to bring that out and to then discuss how we really have no idea what converts an anxiety caused by a stress to convert into stimulating the appropriate nuclei of primarily, and we just talk about the bruxism of the mandible and not get into the effect of those nuclei on the neck muscles or the upper shoulder girdle muscles, but just the masticatory muscles. What converts mental, emotional anxiety into stimulation of those nuclei and the discoordination of those nuclei? There are theories on how that occurs, but we really don't know. So the bottom line of this is that there are a lot of doctors out there and who say, and patients who believe for one reason or another, that they have control or can get control over bruxism. We do not understand the mechanism for bruxism. We know it has something to do with the nuclei, which those signals originate and coordinate through, but we do not even close to fully understand what is going on in that brainstem to create bruxism when a patient is stressed and anxious. And we definitely don't know how anxiety, which is an emotion, creates the motion of the masticatory muscles, which then creates bruxism, which then creates damage to the temporomandibular joint, along with damage to the teeth, tori of various kinds, bilateral mandibular tori, palatal tori, maxillary and mandibular labial exostoses, which they're all bone formation, which are created by extra forces on the teeth, especially lateral forces. Lateral forces on the teeth is what causes tori. That's what causes. And lateral forces on the maxillary teeth spreads the two maxillary segments apart, which creates the palatal torus. So tori are definitely related, and I covered this before, but it's a good place to insert it again. Palatal tori, mandibular tori, and maxillary and mandibular exostosis are definitely related to and caused by bruxism of the teeth, which is caused by stress and anxiety. But what we don't know is how that emotion actually creates stimulation of the nuclei, which creates the motion of the mandible, which creates the bruxism in an involuntary manner. We do not know. So the patient has no control over bruxism. And there are practitioners, plenty of practitioners out there who give the patient a night guard and tell them that that is going to keep them from bruxing their teeth. Now, it's going to protect their teeth. It will protect the teeth. You can't damage your teeth if you have a piece of acrylic in between the upper and lower teeth. You will not eliminate damage to the temporomandibular joint if you just use a night guard. And you will certainly, chew through that night guard, but patients don't have control of bruxism and never will. Now, that brings up the point about some actually major universities that I will leave unnamed that I'm very familiar with personally, who have TMD, TMJ congresses and major programs that bring in psychologists and psychiatrists to examine and treat using psychological and psychiatric methods to get people to stop bruxing their teeth. In my opinion, that is nonsense. That never happens. Never seen it happen. Been aware of it. I know it's talked about a lot. Patients spend a lot of money on psychological and psychiatric treatment, including when you get treated by the psychiatrist, multiple medications. But I've never, ever seen a patient stop bruxing when they are a bruxer, and they usually start early. That's another point. Bruxers don't usually start in their latter part of life. They usually start in the earlier parts of life, as early as probably many of you already know, age 5 or 6. Many moms bring a 5 or 6-year-old boy or girl in and says, my son or daughter makes tremendous amount of noise with their teeth at night, which brings up a point. This is primarily a female problem. And what I have learned to say, to tell moms, if he's a boy, it's highly unlikely that he will develop symptoms associated with bruxism and TMD. And if it's a female, it's highly likely that that female will develop symptoms. But if they do not have any symptoms, meaning headache, earache, jaw pain, neck pain, shoulder pain, in a youngster like that, I tell them, don't worry about it until they have any symptoms. They may or may not develop symptoms, but it's a female highly likely to develop symptoms. It's a male highly unlikely to develop symptoms. And why is that? What's the difference? Because estrogen exacerbates inflammation. Discussed thoroughly in prior episodes. You see, it all fits together. I mean, it just all the pieces fit together very nicely. But the point of this episode is to drive home that there is no solution for bruxism. We don't understand bruxism. There is no on and off solution. We do not even have a good definition for stress. And of course, the patients, if it's a female, frequently says, well, I know what stress is. Stress is my husband. If it's a male, I often hear, I know what stress is my wife. Everyone says, I know what stress is, it's my work. Patients come in and they say, I'm just so stressed in traffic. We all know the stresses, greater or lesser. We all don't get through life without significant amount of stress. And then it's a matter of how we handle it. So it's mediated by the brainstem, specifically the nuclei, and there are things that go in and among and between those nuclei that we do not fully understand. And the question of how the nuclei get stimulated by an emotion is really not known. There's some theories out there, but we don't need to talk about theories. So how do you handle stress? Well, again, this is common sense. This is not necessarily only in the dental arena. Frankly, if you are a physician, you spend a lot of your time handling patients with stress. And because stress causes a lot of disease. Stress is well known for suppressing the immune system. People who are stressed get sicker more often than people who are not stressed. Very good reason to handle your stress. Very good reason not to be stressed. Very good reason to decrease your anxiety. So these are the four major things that you can do, which don't include medication and don't include psychological or psychiatric assistance, and that you can do on your own to decrease stress, which may at times decrease the quantity and quality of the bruxism. But in my examination in history, I have never seen a patient who bruxes who just totally stops bruxing. But I've seen many patients, I've had many hundreds of histories where patients would come in and they'd say, I was doing fine, I'm using the device, it's working really well, but all of a sudden I had a death in the family, or I had a major stress of I lost my job. And I just really, I know I've been bruxing a whole lot more, and it really started to hurt a lot more, which usually the solution to that is just wear the device more often at the beginning. Just wear it more often to decrease the inflammation, because more bruxism causes more inflammation, and wearing the device, which separates posterior teeth and unloads the joint and decreases the inflammation, decreasing the inflammation versus increasing the inflammation with bruxism. So what can you do to handle stress and anxiety? Well, anxiety can be handled by exercise. Everybody knows that. It's the runner's high, and patients who are frequently and continuously well exercised are well known to have much less emotional stress. To decrease and avoid addictive substances, because they are very stressful. And I think some of you might be surprised to hear what I have to say about what are addictive substances. Obviously, opioids. There are also neuroleptics, SSRIs. Those are well-known substances that are addictive, but also sugar, nicotine, and caffeine, very addictive. Now, you may not be able to give them up. You may not want to give them up. All I'm telling you is that if you want to decrease anxiety, part of that emotional anxiety may be increased by substances like sugar, which is addictive, nicotine, and caffeine. And then, of course, medications, best known, most obviously known, opioids and neuroleptics. The third is increasing sleep. The better you sleep, of course, that is a circle, which, more stress decreases your sleep, creates more stress, chasing your tail. But increasing your sleep will decrease your anxiety, and of course, decreasing stressful situations. And, if you know that, if you know that flying an airplane is going to be a stressful situation, then don't fly the airplane. If you know that, driving in traffic is a stressful situation, then try, take your trip when there isn't any traffic. Just a lot of common sense. And you know what? When I explain these things to patients, some of them look at me like I've enlightened them, like something that they've never thought of before. Honestly, I don't laugh at them. I try not to indicate it anything other than I'm trying to help them. But Yeah, it started to surprise me years ago when I take some very simple information and deliver it to patients, and they look at me like I've given them the keys to the kingdom because it makes so much sense to them, but they never thought of it before. And that kind of brings in kind of the last part I want to talk about is, how this interfaces with patients. You have to be patient with patients. And I've had episodes where I've talked about that significantly. But your patients, if you deal with TMD, you will deal with a lot of patients who literally have emotional problems, which can bring on bruxism, can bring on the symptoms, but emotional problems is not necessarily their causative factor. The emotional problems may be related to, and frequently is, significant years and years of symptoms. I ask you, if you have never treated these patients, or if you do treat these patients, to think about what it would be like to have a constant headache or an intermittent headache that happens several times a day, which is associated with ear pain and neck pain and shoulder tightness, which are headache, earache, jaw pain, and neck pain are the 4 most frequent symptoms of TMD. Headache, neck pain, headache number 1, neck pain number 2. And if you had a combination of those 4 symptoms for a long period of time, like 10 years, how would you feel? Would you be emotionally stable? Would you be happy? Would you respond to your friends, family, and your doctor in a reasonable way? My associate mentioned we were talking about a specific case. He asked me a question about it, and he described the case and described how angry the patient was during the consultation. But what he wanted to describe, and this is a win, his description was he was so pleased when the patient came in at 3 weeks and with a smile on her face and was very pleased, and her personality had totally changed. Personality totally changed, and I see that all the time. I've mentioned before, you not infrequently walk in a room and literally the body sitting in front of you, the person sitting in front of you, looks different. It's a different person sitting in front of you when they are relieved of these painful and life-devastating symptoms. And we hear so often about what we do and how we do it. The point is, I hear so often, this changed my life. It changed my life. And it is. And you can see it when you walk in the room. The patient looks like a different person sitting there. And those are the effects of stresses, creating anxiety, creating bruxism, creating damage to the temporomandibular joint, creating chronic inflammation within the temporomandibular joint, creating various kinds of pains, headache, earache, jaw pain, neck pain, tinnitus, subjective hearing loss, vertigo, upper back and shoulder pain, arm, hand, finger tingling, and numbness, and various kinds of locking. You can imagine how anxious a patient becomes, generates even more anxiety when they can't open their mouth. We see that all the time. Very anxious, very stressful, because they don't know what's going on. All they know is it hurts like heck to open their mouth, and they can't get but open 25 millimeters. So what do we know? We know that bruxism is associated with TMD, for sure. Can you fix bruxism? No. Can you talk a patient out of stopping to brux their teeth? Or can you give them drugs that will stop them bruxing their teeth? No, doesn't happen. Does a night guard stop someone from bruxing their teeth? No, does not happen. So we know some things. We know some things anatomically. I brought to your attention the nuclei and the brainstem, where like mystical things sometimes go on there. We know where the nuclei are. We know which nuclei are associated with which cranial nerves. both sensory and motor. But we do not know, and and I'd love to know. I wish there was a way to figure it out. I can't even think of an experiment of how to figure this out. There are brighter people than me that are working on this problem. But we do not understand how anxiety converts into stimulating the brainstem and the stuff inside the brainstem, which creates bruxism. We do not know that. And so you should tell the patients when you see them, you're never going to stop bruxing. I do. I tell each and every patient who comes in with a history of bruxing, clenching or grinding, that you are never going to stop clenching or grinding. That is not our objective here. And even though, very interesting, even though I say that, and I might say that 1 or 2 or 3 times during a consultation, the patient will come in. Oh my God, I've had this happen at least 100 times, probably 200, maybe 300. Patient will come in at 3 weeks or 2 months and they go, you know, my headaches are so much better and my ear doesn't hurt anymore. And my neck is not stiff anymore, you know, but I'm still grinding my teeth. And I know because I tell everyone, 100% of my patients that come in for a consultation that have a history of bruxing or don't have a history of bruxing, but I see those tori, I say, you are a bruxer, but you're never going to stop. But they continually come in and tell me that their symptoms are so much better, but they're still grinding their teeth. And they're surprised that they're still grinding their teeth. That goes to it goes as a statement about dealing with people, dealing with patients. And you just smile and go on. That's what I do. You may have your own way, but I just smile and go on because it's part of our job. I think I beat that horse enough. And I hope it was helpful to you. I do these in a help fashion. That's my only purpose for doing these. Like I'm surprised sometimes about what patients don't know, about what I think are kind of common sense things. Well, I'm surprised sometimes what my colleagues don't know about which things that are, to me, seem very, very obvious and very, very simple. And that's what I brought out today about bruxism, about stress and anxiety and the relationship between the two and how it all works and what we don't know about it. For today, I look forward to the next time I can do another episode in a week. I can be reached, criticized, or made comments to at tony@urbanictmj.com. That's our new improved website. Our Director of Marketing Education, Dr. Naomi Williams, who was just recently married, used to be Engelman. Dr. Naomi can be reached at naomi@tmjservices.net. And our website is www.urbanictmj.com. I look forward to speaking with you next time. Until then, I hope you have a very successful week and treat a lot of TMJ patients successfully.